Hey everyone, and welcome to our workshop. This is chapter 14 of the Brain Resource Creation Workshop, which focuses on injury and illness associated with the brain. We would like to extend a warm welcome to everyone watching this video right now, and we sincerely thank you for your interest in this workshop. This presentation is brought to you by Simply Neuroscience. It has been created by Jed Q and edited by Natalia M, Shalu M, and Casey A.
Before we discuss the specifics of a brain tumor, it is important to address the two different types of brain tumors because they are classified based on their origin. Primary brain tumors develop in the brain, and metastatic brain tumors form from other tumors in the body. The main regions that cause the development of a metastatic brain tumor are the lung, breast, skin, or kidney.
So what other differences can be found between the two types of tumors? Well, for one, it is more likely to be diagnosed with a metastatic brain tumor than a primary brain tumor. In fact, metastatic tumors account for half of all central nervous system tumors. Due to the close proximity of the brain, lung, and breast cancer leads to the development of a metastatic brain tumor. Many of you have heard of an illness called lymphoma, but did you know it's classified as a primary brain tumor? In lymphoma, cancer cells form in the lymph tissue of the brain or spinal cord. Thus, it is a primary brain tumor.
It is very scary to be diagnosed with a brain tumor due to its survival rate. Many cancer patients need to get the tumor surgically removed for a chance to even survive. The two types of primary brain tumors are named after the brain area they develop in. For example, gliomas come from glial cells, which support and protect neurons in the brain. Meningioma comes from meninges, which are the thin tissue layers covering the brain. This is a benign tumor, or a tumor that does not spread. It is also the most common type of primary tumor.
To gauge just how prominent brain tumors are, here are some statistics. More than 79,000 people in the United States alone get diagnosed with primary brain tumors. Of those 79,000, 26,000 are cancerous and 53,000 are non-cancerous. The most common type of brain tumor is glioblastoma, which is a proliferation of immature glial cells.
When someone has brain cancer, they may experience several symptoms such as headaches, difficulty with sight, seizures, memory loss, and confusion.
So, how can one treat a brain tumor? One option is to remove a brain tumor through surgery. Another treatment is radiation or chemotherapy, which can mitigate the tumor.
The next neurological illness we will be discussing is neurological trauma. This illness can be classified into two specific categories: traumatic brain injury and spinal cord injury. Something interesting about traumatic brain injury is that the leading cause of this injury is falling. About 275,000 people are hospitalized every year because of this.
Chronic traumatic encephalopathy, or otherwise referred to as CTE, which is what I will refer to it as, is induced by repetitive concussions or head trauma. Essentially, this is the degeneration of brain tissue and buildup of abnormal proteins. Some symptoms one may experience is memory loss, confusion, impaired judgment, and progressive dementia.
Spinal cord injuries can lead to permanent nerve damage or other degrees of paralysis. This disease is incurable, but there is a medication that can reduce damage and inflammation at the affected site, and this is called methylprednisolone. Another treatment option is physical or occupational therapy and electrical stimulation.
HIVs are a neurologically acquired immunodeficiency syndrome. In HIV, the immune and nervous systems are attacked. With HIV-associated neurocognitive disorders, it leads to difficulty in coordination, memory, and decision-making. In addition, it increases vulnerability to cancers and infections. This can be treated by antiretroviral drugs.
Here are some ways HIV and AIDS are transmitted and not transmitted.
HIV actually triggers another neurological condition called peripheral neuropathy. This has many uncomfortable symptoms such as tingling, burning, and severe pain.
Multiple sclerosis is an inflammatory disease of the central nervous system. This is when the immune system attacks the brain and other areas in the nervous system, causing the myelin sheath to form lesions. The myelin sheath is essentially a layer of fat that protects the nerve, so when it tears, nerve communication is affected.
The cause of MS is unknown. However, doctors think that it may be due to genetic and geographical factors. There are a number of symptoms associated with this disease. Some include numbness, clumsiness, slurred speech, and memory loss.
Unfortunately, MS is incurable, but treatment towards this disease is improving. Scientists tested steroid drugs, and this helps mitigate inflammation and acute attacks. In addition, there are medications to control symptoms such as mood swings and bladder dysfunction.
There are three types of MS: relapsing remitting, primary progressive, and secondary progressive. In relapsing remitting MS, there are flare-ups of new symptoms, which leads to complete or partial remission of symptoms. In primary progressive MS, the symptoms progressively get worse after the disease onset. In secondary progressive MS, the relapse remitting MS transitions into a progressively worsening form of the disease.
One of the last conditions we will be discussing is chronic pain. This can persist from weeks to even years. Back pain, severe headaches are just a few conditions that fall into this category. This disease can lead to changes in perception, motivation, and mood. There are different treatment options for this disease, which we will discuss in the next slide.
To treat pain, one can ingest anesthesia or painkillers. Examples of painkillers are aspirin, opioids, or antidepressants. Another option is to go through psychological therapy.
The last neurological condition we will be discussing is stroke. This is the interruption of blood flow to the brain due to the ruptured blood vessel or a clot. The potential risks that can arise from this situation is obesity, physical inactivity, and heart disease. However, this can be controlled by maintaining a healthy weight, avoiding alcohol, and taking high medications for high blood pressure.
Treatment options include clot-dissolving medications to restore circulation before blood oxygen loss prevents permanent brain damage. Another treatment are anticoagulant drugs, which reduce the probability of clot formation.
Thank you so much for tuning in to this workshop on neurological diseases and conditions. We hope you learned new things, and if you have any questions, feel free to contact us.